My name is Marissa Fratoni, and I'm a registered nurse and multidisciplined integrative health practitioner with a background in massage therapy, yoga, and integrative nutrition wellness coaching. I am also a patient who lives with chronic pain. I manage my symptoms with meditation, yoga, and you guessed it, cannabis. Today we'll be discussing the role of cannabis in relieving arthritis symptoms. So let's get to it. Got a lot to cover here. So what is arthritis? Well, arthritis means joint inflammation. There are more than 100 identified types of arthritis. It is common, but it's not well understood. Over 52 million American adults have arthritis or a rheumatic condition diagnosis. 26% of women in this country have arthritis, and 19% of men have a doctor-diagnosed arthritis condition. By 2030, the number of people with arthritis, adults 18 years and older, is projected to be about 67 million people. And there are more than 350 million people worldwide suffering from arthritis. Most common types of arthritis are osteoarthritis, or OA, rheumatoid arthritis, or RA, psoriatic arthritis, lupus, and childhood arthritis. Arthritis may be a condition that develops over time and occurs with aging, as is the case with osteoarthritis. And I'm sorry, before I forget, if you do have any questions, please leave them in the Q&A and we'll get to them at the end of the presentation, time permitting. And you can also connect with me. My contact information was at the beginning, but I will also leave it in the chat box as well. Sorry. Okay, back. So arthritis may also be the result from an autoimmune condition, which is the case with rheumatoid arthritis, psoriatic arthritis, lupus, and childhood arthritis. Arthritis sufferers make up one of the largest groups of people using cannabis medicines. The main reason, well, phytocannabinoid medicine or plant-based medicines are effective in relieving pain and inflammation with far less side effects than conventional medicines. For the purpose and brevity of this presentation, we will focus on osteoarthritis, which is the most common form of arthritis having to do with weight-bearing joints, such as the hips and the knees. And we'll also focus on rheumatoid arthritis, which is the most common form of inflammatory arthritis, which tends to affect the small joints in the hands and the feet, but doesn't discriminate and can affect any joint in the body, including the spine. All right, so let's dig in. We'll talk about OA. Osteoarthritis is degenerative joint disease, often called wear and tear arthritis. The symptoms include pain or aching, stiffness, decreased range of motion over time, or reduced flexibility, and swelling. And as you can see, we start with a normal joint with and then over time, what happens is the cartilage starts to thin and it wears away. And lo and behold, you have bone on bone rubbing, which leads to destruction, further destruction of the joint. This is related to a lot of conditions, but a lot of people in this country, we have diabetes and obesity. And so it certainly is a condition that affects people who are overweight. With OA, the cartilage within the joint begins to break down and the underlying bone begins to change. And some people are no longer, over time, some people are no longer able to do daily tasks or work. It can be very debilitating. Risk factors for OA include joint injury or overuse, age, gender, obesity, genetics, and race. And we'll go through each one of these points. Joint injury or overuse, such as knee bending or repetitive stress in a joint, can damage a joint and increase the risk of OA in that joint. And sometimes this has to do with malalignments in the joint. Age, the risk of developing OA increases with age. Gender, women are more likely to develop OA than men, especially after the age of 50. Obesity, I was just talking about this. Extra weight puts more stress on the joints, particularly weight-bearing joints like the hips and the knees. This stress increases the risk of OA in that joint. Obesity may also have metabolic effects that increase the risk of OA. Genetics, people who have family members with OA are more likely to develop OA. And people have OA in one joint are also likely to develop that in another joint. Race, this is an interesting piece. Although no race is exempt from the development of OA, some Asian populations have lower risk of OA. The reasons for lowered incidence of arthritis in these cultures may be related to diets comprised of mostly plants instead of processed foods and meat, which promote increased inflammation. Active lifestyle, where walking and cycling are more common than driving. And then another key difference is between Western and Asian cultures is squatting in Asian cultures is a traditional resting and working posture. In this culture, we use we use chairs. So it certainly changes the way that we use our joints. So when we talk about treatment for osteoarthritis, we're really talking about reducing the pain, the stiffness, and other symptoms. We're looking to improve joint function, of course, slow the disease process, stop it from getting worse, and we're looking to maintain or improve quality of life. Movement is essential if you are living with arthritis. Exercise helps to limit the pain and improve joint motion. It also boosts energy levels, improves strength and stability. Movement helps your joints be healthier. And in case you were wondering, research indicates that all of these benefits of movement stem from the upregulation of the endocannabinoid system. Regular movement combined with a healthful diet helps maintain optimal weight, which helps to reduce wear and tear forces to affected joints. Braces and orthotics may be helpful to support weakened joints and improve stability. Medications range from over-the-counter meds such as Tylenol, NSAIDs, or non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen. And then in some cases, steroid or cortisone injections may be necessary as well. Unfortunately, side effects and limited effectiveness of these medications is not uncommon. An added issue, OA may exist with comorbidities such as kidney disease, diabetes, and high blood pressure, all of which may be contraindicated for the use of these medications, which really limits treatment options. And when all of these treatment options have been exhausted, surgery may be indicated. In fact, a study published in the Journal of Bone and Joint Surgery estimated that about 7 million Americans are living with total hip and knee replacement. Let's switch gears to rheumatoid arthritis, which is an autoimmune inflammatory disease. This means that your immune system attacks healthy cells in your body by mistake. It causes inflammation, painful swelling in affected areas. RA mainly attacks the joints, usually many joints at once. RA commonly affects joints in the hands, wrists, and knees. You'll see that characteristic picture of the crooked fingers. That is rheumatoid arthritis. RA can also affect other tissues throughout the body and cause problems in organs such as lungs, heart, and eyes. Symptoms of RA include pain or aching in more than one joint, stiffness in more than one joint, tenderness and swelling in more than one joint, and the same symptoms on both sides of the body, such as in both hands or both knees. In a joint with RA, the lining of the joint becomes inflamed, causing damage to the joint tissue. This tissue can cause long-lasting or chronic pain, unsteadiness, lack of balance, and deformity, hence those crooked fingers. Some other symptoms may include weight loss, fever, fatigue, tiredness, and weakness. Risk factors associated with RA. RA can begin at any age, but the likelihood increases with age. The onset of RA is highest amongst adults in their 60s. Gender, new cases of RA are typically 2 to 3 times higher, again, in women than men. Genetics, people born with specific genes are more likely to develop RA. The risk of RA may be highest when people with these genes are exposed to environmental factors like smoking or when a person is obese. Smoking tobacco, multiple studies show that cigarette smoking increases a person's risk of developing RA and can make the disease worse. History of live births. There's actually some interesting data here where women who have never given birth may be at greater risk of developing RA. Again, that's not well understood. It's in the research. Early life exposures. Some early life exposures may increase risk of developing RA in adulthood. For example, one study found that children whose mothers smoked had double the risk of developing RA as adults. Children of lower income parents are also at increased risk of developing RA as adults. And then obesity, once again, being obese can increase the risk of developing RA. Studies examining the role of obesity also found that the more overweight a person was, the higher his or her risk of developing RA became. Treatments, again, it's not a great offering. You have immunosuppressants such as methotrexate and disease-modifying anti-rheumatic drugs, or DMARDs. These are both classes of drugs that require careful monitoring from a qualified health professional for effectiveness, side effects, adverse reactions, and they carry a lot of side effects and adverse reactions, and they might not work all that well. Self-care is really important. Movement, again, a diet comprised of mostly plants, staying adequately hydrated, really getting adequate rest, ensuring optimal sleep hygiene, making sure that you're sleeping, an adequate amount every night. And engaging in mindfulness practices such as yoga may help the affected person cope with and improve their symptoms. Physical therapy may be helpful to strengthen weakened joints and maintain function. And over time, surgery may be necessary to improve quality of life if pain, stiffness, and dysfunction in affected joints is unbearable. So how can cannabis help? Well, there are cannabinoid receptors in the tissues that comprise the joints, which means the ECS is a great target for treating arthritis. And animal studies confirm that upregulation of the ECS increased endocannabinoid levels, which prompted the ECS to relieve inflammation. That actually came from a study that studied rats with osteoarthritis, which is really interesting because who knew that rats had osteoarthritis? This study focused on, it sort of gave credence to what these findings are, that the ECS is certainly implicated in joint health. Time and again, animal studies substantiate the use of cannabis as potent anti-inflammatory medicine. Anecdotal evidence continues to expand, and though human clinical trials are still incredibly limited, this study conducted in the UK was a randomized, double-blind, parallel group study of 58 patients over 5 weeks of treatment. This is the golden standard for clinical research. 31 patients were given Sativex, which is a 1-to-1 CBD to THC spray, administered to the mouth. Each patient took a low dose of this medicine in the evening, and their pain on movement, pain on rest, stiffness, and sleep quality were assessed in the morning. The researchers found that a significant analgesic effect was observed, and disease activity was significantly suppressed following treatment. This study suggests that low-dose cannabis medicine is effective at relieving symptoms of inflammatory arthritis. And we can't say it enough. You really want to consider starting low and going slow. So starting at a low dose and increasing slowly over time for the best therapeutic effect. I have a case study to share that backs this recommendation up. So this was a client of mine, 67-year-old female patient, reports that she has bone-on-bone knees. She enjoys staying active, but has been finding it challenging to do so due to pain. She reports that she has recently lost 20 pounds from walking daily and with her new diet. She reports that she cannot take ibuprofen due to stomach ulcer, and Tylenol doesn't work. She has been prescribed other pain med, tramadol, which she can't stand because the side effects include constipation and feeling drowsy. Her doctor recommends total knee replacement, but she has to lose 30 more pounds prior to surgery. She is perplexed as to how to lose more weight since moving is painful, and she feels she has plateaued on her diet. She hasn't used cannabis since before she had children, and now her kids are almost 40 years old. She does not want to smoke or feel impaired. We hear that a lot. So she starts, first of all, let me tell you that the patient received medical cannabis card and recommendations from a certified health provider. With guidance from me, her cannabis nurse, she chose a tincture and topical at the local dispensary. She started on a 1-to-1 CBD to THC tincture. The recommending physician told her to start at 2.5 milligrams, so that's what we went with, 2.5 milligrams in the morning and the evening. She also applied a 1-to-1 topical lotion twice daily to both knees. Patient reported needing to increase tincture dose to 5 milligrams in the morning and in the evening. She made that increase about 2 weeks after trying the lower dose. She reported after a week that her pain is much improved and she's able to stay active. Her pain improved so much that she and her doctor agreed to postpone surgery indefinitely. And she was really excited because she had so much less pain when she was walking. So, this sort of supports the idea that for the best outcomes, you really want to work with a cannabis knowledgeable health professional for guidance, support, and coaching for the best outcomes. Doing so typically means less trial and error, less time and financial resources spent, and most importantly, effective relief of symptoms with less side effects happens sooner than later. And in closing, because I am a yogi, if you would like to join me, I'd like to offer you metta, which is positive energy and kindness. If you want, you can sit up nice and tall. I'm going to do that. Let's take a deep inhale through the nose. Exhale through the mouth. If it serves you, you can bring your hands to prayer position at heart center. May you be free from mental suffering. May you be free from physical suffering. May you have ease of well-being. Thank you for attending my presentation. Namaste. And here are some resources for you. And I'm going to stop my fancy screen sharing, and I am happy to answer any questions. Let's see what I have to look in the Q&A box. Thank you, Catherine. Any questions, anyone? Thank you, Julie. If you want, you're welcome to join me on screen and we can talk. I guess we do have a shy group. Question in the chat, did your patient stay at 2.5 milligrams or increase? She increased to 5 milligrams, and then last I spoke with her, she was up to 7 milligrams in the morning, and I think she said 5 milligrams at night. So, and she was also taking holidays. Actually, once I sent her to Healer, where she learned how to, she really didn't want to take very much, so she actually used Dr. Sulak's and desensitization protocol, kept her at a really low dose. Does CBD or THC interfere with typical RA medications? That is a great question. We definitely have to be mindful of interactions with cannabidiol. There is a risk there, and there's some wonderful primers that are available. One that I like to access often is the Project CBD primer on drug interactions. You're welcome, Peter. Thank you. I'm going to check the Q&A over here. Oh, Peter, thank you for putting it in the chat. Anyone know any good jokes? I don't. You don't want to have me tell a joke. Sure. Related to arthritis, I have another patient who is in their 70s, bone on bone hips. Very similar story. Started using a very small amount of cannabis. Started with topicals. Was very, very frightened about THC. Added in some edibles, actually, very low dose edibles, and I believe she had one hip replaced, but she had a tough rehabilitation after surgery, was very scared to get the other hip replaced. And last I talked to her, she was taking these low-dose edibles and applying the topicals, and she was able to push off surgery, and she's hoping to not have to go and do the other hip. And her quality of life has greatly improved. And she said that she too, she uses cannabis before she goes to physical therapy. And she said the difference between using cannabis, when she wasn't using cannabis and doing physical therapy was sort of torturous. Now she uses cannabis prior to going to physical therapy, and it's made all the difference. Let's see, cannabis ingredients can make a difference in product efficacy. Yeah. Carry ingredients. What have you seen as particularly effective when it comes to topicals? There are, I've seen lotions be very effective. A lot of my patients haven't really appreciated the greasy oil-based products. They complain that it gets on their clothes and all that sort of stuff. So there's some great lotions available in some of the dispensaries that they absorb well, they absorb dry, and they seem to be much more popular. I have RA and lupus. I use CBD. Is there a way to reduce THC tolerance from daily or weekly use? Sure. In some cases, taking even just a 48-hour holiday, if you can spare it, can be helpful. On those days, the patient that I featured here, she was using meditation as a way to help her on the days where she was really taking off from cannabis. And that helped her to maintain her THC tolerance at a very low rate. Not off the top of my head, methotrexate and cannabis use in RA. I don't have that information at the top of my head. You're welcome, Peter. Thank you. Gail, thank you. It's good to see you here. Gail, that's an interesting question. Gail asked, any knowledge of methotrexate and cannabis use in RA? Hi, Eloise. So what time is it? Oh, are we over time? Should we move on? Okay. Well, thank you, everyone. It's been a pleasure. Thank you for attending my presentation. It's been a real honor here. All right. Thank you. Bye, everyone.